Dr. Phyllis Leppert, and I'm Professor Emeritus of OBGYN at Duke University and President of the Campion Fund. I'd like to tell you a little bit about why we want to fund uterine fibroid research. Fibroids are very common. They occur in 80% of African American women and in 70% of Caucasian women. And they are the leading cause of hysterectomy in the United States. Okay. Patients are really bothered by the symptoms of fibroids. One of my colleagues has written a textbook about fibroids, and in the preface, he quotes from two women who have fibroids. Because of my fibroids, my cycle was very heavy, which meant that I had to visit the ladies' room every 1 to 2 hours to change my tampon and pad. I feared that my clothes would get soiled in public, and so I would rarely socialize. I was severely anemic and had no energy, so I felt weak, lethargic, and lacked enthusiasm most of the time. In addition, I frequently had the urge to urinate, only to find out that it was just a few drops of urine. This is the comments of a second patient. She says, I am 73 years old. Persons my age look back upon life and weigh pleasures and disappointments, joys and sadness and satisfactions and regret. My greatest regret is that I never had children of my own. A large fibroid causing great pain, pressure, and debilitating bleeding.
So, right now, hysterectomy is always a viable option. Myomectomy, removing just the fibroids, is an option. Uterine artery embolization is an option. Focused ultrasound is an option. For certain types of fibroids, endometrial ablation is an option. So those are all the procedures that are currently in use. There are some newer procedures that are also being tested and have been FDA approved, but they're not in widespread use yet. There are a variety of treatments that are medical treatments that may help alleviate some of the symptoms of fibroids. So, birth control pills or other hormonal agents, non-steroidal drugs like ibuprofen. All of those may help some of the pain symptoms or the bleeding symptoms, but they don't change the underlying natural history or structure of the fibroids. The biggest problem we have with fibroids right now is that there's not good comparative effectiveness research. There are, for some treatments, fairly good studies following up patients who've been treated with those treatments. So, for example, for uterine artery embolization, we have studies of thousands of women who were followed for 2 to 3 years, and we have a pretty good sense of what happens. But we don't know how that would compare to what would happen if the same woman had a myomectomy, or with enough numbers to be confident to know what the harms and benefits are for a particular patient. So we don't have the information to compare outcomes. That's, I think, the highest priority. In work that's been sponsored by the Agency for Healthcare Research and Quality, by far the biggest unanswered question to patients and other people involved in caring for women with fibroids is how long do these treatments last? What are predictors for a given woman who doesn't have a hysterectomy to say, will she have recurrent symptoms, and if so, when? Another huge unanswered question is what are the effects of these treatments on women's ability to get pregnant, and to, if they get pregnant, to have a successful, safe pregnancy. And for a variety of reasons, it's incredibly hard to study without very large numbers of patients. Women with fibroids tend to be in their 30s and 40s, so it's harder for them to get pregnant anyway. and if they do get pregnant, they're at a higher risk of complications. Burden of fibroids before they get treated, and then there's the burden of the treatment itself. And so one of the symptoms of fibroids, the most common symptom being bleeding, often affects women's ability to work, to take care of their children. There have been studies that show that women with symptomatic fibroids have high degrees of either missing work or not being as productive at work as they can. So that has an obvious non-medical economic cost. Many women, particularly with heavy bleeding, need to spend a lot of money out of pocket for things like sanitary pads, or they may use things like ibuprofen over the counter to help with some of their symptoms. And the treatments themselves, because most of the longer lasting ones are procedural treatments, tend to have a high cost of actually doing the treatment and then following up the patient. The final piece is that for many women, the symptoms recur. That other than hysterectomy, none of these treatments are 100% effective in preventing recurrence of fibroids. And so women will often have multiple treatments over the course of their lifetime with fibroids.
The cost to our society for treating uterine fibroids is tremendous if you think about the fact that this is one of the most common disorders of women that requires a treatment, whatever that treatment is. For instance, women with symptoms are going to lose time from work. They have quality of life issues if you consider the fact that the most common complaints are abnormal bleeding and pain or girth issues with their body. And so regardless of what treatment you're talking about, it has a cost to society. If you think about it from the perspective that the most common treatment for this has been hysterectomy, think about the number of days lost from work, or think about the number of days lost in productivity. Those are the cost issues. The dollar cost is kind of hard to even measure when you think about this disorder, but you know it has to be a significant amount of money for treatment and for treating patients up to the point where they ultimately make a decision about what the treatments they're going to give. Fortunately, we have a number of treatment options now, which can impact the overall quality of care for women. So my challenge as a maternal fetal medicine specialist for women with fibroids relates to several aspects. For instance, women with fibroids who are pregnant can have problems getting pregnant. They can also have problems with pregnancy losses, particularly for certain types of fibroids that impact on the surface of the uterus, or what we refer to as submucous fibroids. They can cause first trimester bleeding, but ultimately can cause loss. But in addition to that, fibroids in pregnancy have a tendency to sometimes undergo degeneration. And that means that they lose their blood supply, cause a significant amount of pain. And that is a very difficult problem to manage during a pregnancy for those patients. So those are the kind of things that we have to think about, and we have to counsel women in that aspect. And knowing where the fibroids are is very important for birth. If the woman has to have a cesarean, for instance, sometimes the fibroids are so large that it interferes with our ability to reclose the uterus. So counseling and discussion with the woman with fibroids who's pregnant is very, very important in our assessment and evaluation of it. You know, I spent a whole career studying women's health disparities, and in fact, my interest in uterine fibroids was related to that. Having had so many of my friends, colleagues, patients who were of African descent with very large fibroids and having to deal with them even at earlier ages. Why the higher prevalence in African women of African descent? I think we're going to have to leave that to the scientists to continue to decipher. And this is the reason that basic research in fibroids is so important because of this disparity. But here's the issue. The issue of having a higher burden of women who are of African descent with all the other issues that we think about with disparity and incomes and so forth and so on impacts their ability to get treatment. And so we have invested a lot of years and time, in fact, in non-invasive treatments for fibroids. And this is the reason that I became very interested in various treatment modalities that I've written on, like focused ultrasound, for instance, of treatment of fibroids. I think the diversity of treatments really has an importance to women of African descent, particularly if it improves their quality of life without having to have a hysterectomy. And so keep in mind that this is still the most common reason for hysterectomy in black women related to fibroids. And that is something that we need to continue to evaluate and continue to study. But yes, there's no question that we have this greater disparity. But I would like to say that we need not only to continue to be innovative in treatment, but we need to invest in science to understand this disparity difference that exists. So the basic goal for research is really to understand not only the dynamics of why fibroids develop, why they grow to the size they do in some women, but also to understand why some women are more likely to have those fibroids. This is very important to our understanding of disparity. African American women with fibroids within the families. Understanding the basic science of this really will impact what treatments we can develop for fibroids at their smaller sizes and at their larger sizes. If fibroids are going to impact a woman's fertility, what interventions we might be able to do before they impact her fertility is going to be important. So those are the keys. We have so much work left to do in understanding the basic physiology. But then we have to have the studies, the comparative clinical trials for different treatment modalities. Those are the keys. And so for the next 10 years, this has to be an area of focus, an area of women's health research for the most common benign gynecologic condition in women that exists. That's it. And I think that that's where I want to see us go with fibroids.
Because of my experience in taking care of so many patients with fibroids, when we started the Campion Fund to raise money for research, we decided that the first thing we wanted to focus on was uterine fibroids, because we know so little about the biology of uterine fibroids. If we don't understand the biology of a disease, it's very difficult to design drugs and therapies that are going to be targeted to the basic cause of the disease. For this reason, we are campaigning for funding for basic research in uterine fibroids. The Campion Fund is a public charity, and we are in existence to fund reproductive biology at a very basic level so that we can really solve some of these problems. For this reason, we would like you to donate to the Campion Fund.